On Thursday, August 20, the Medical Association of Jamaica released a statement expressing concern for the surge in COVID-19 cases on the brink of the 2020 elections. The cases have surged even higher since then. So we invited the president of the MAJ, Dr. Andrew Manning, to weigh in on the current situation. He now joins myself and Simone online. Hi, Dr. Manning, morning. How are you?
Hi, morning. I'm fine. How are you?
I am good. You're speaking with Delia and Simone.
Hi,
Doc,
morning.
I'm not even sure where to start because before this, you were already expressing concerns. Now we've
Yes.
gone into hundreds, 88. What is the MAJ saying about this latest surge in Jamaica with the coronavirus?
So we're saying that we all members of the public, all of us need to start taking this thing seriously. We are at a critical juncture. Yes, we're seeing a surge of cases, and we cannot afford to have this thing get out of control like a wildfire. We are still doing better than many other countries of similar size. And certainly we're doing better than a lot of the other countries in our region, which is PAHO. But we can't afford to let this get out of control.
I want you to
Now,
qualify that for me, Doc. When you say we can't afford to let it get out of control, I think people fail to understand the strain it will have on our resources here in Jamaica, and that if it becomes too much, we will not have the capacity to treat as many people as we should. What are we looking at?
you're exactly right. So let's look at some numbers. Let us say that 2% of persons who get the virus will need critical care and possibly ventilator support. Now, we have allotted about 40 beds for COVID patients who require ventilator support. So, if we were to say have 200 cases a day, that means that there will be 4 new patients who would need ICU beds. So if you do the math, you could see that within 10 days, a couple weeks, not long from now, we would exhaust our capability to care for these persons. And that simply means that many of these persons would turn up to our hospitals, to the accident and emergency units, and they would die. It's as simple and as stark as that. But we can, and others have, prevent this by slowing the curve. COVID-19 is a wave that is passing through Jamaica. If it passes through quickly, many people are going to die. If it passes through slowly, we should be able to cope with it. And the thing that will slow down the wave is for persons to respect the social distancing, to wear their masks, to not accumulate in crowds, to not have unsanctioned parties and venues where you have a lot of crowding and so on.
Let me ask you, Doc. I'm looking at the communication re the surge in cases and elections, where the association is saying our observations of nomination day on Tuesday were disheartening, very strong word.
Yes.
You say at this critical juncture, the MAJ is calling on the leaders of both political parties to pay more than lip service to the public health measures initiated to battle COVID-19. We're calling on them to declare publicly specific measures that they will take at this time to aid in the fight against COVID-19. I mean, since then, they've both said they're suspending road tours and large motorcades. But this statement shows me that your association was really very, very, very upset. You thought this to be a very bad decision. Talk to me a little bit about that, and then tell me if you think the measures implemented have gone far enough.
Well, our members are on the front line, and he who feels it knows it. We know what will happen when persons come in, and it's sickening when persons come in and you can't treat them because you don't have enough bed space or a ventilator to treat somebody. And also, healthcare workers are at increased risk of contracting the virus.
Correct.
In fact, we're at increased risk of contracting a severe form of COVID-19. Now, on nomination day, you had persons gathering in crowds, scores, if not hundreds of persons. There was no, certainly from what I saw, no attempt to have physical distancing, and most of the persons didn't have on any masks. Now, this is something that we should be able to control as a country moving forward with the campaign. The Prime Minister did announce yesterday, and I think the opposition party announced that they were not going to have some of the campaign activities
Right.
that were attended with crowds and so on. But actions speak louder than words. Action, not a bag of mouth. That's what we need to see moving forward. And in fact,
So you're
we
waiting.
are
So you don't have. Is it that you don't have a lot of faith in what they have said? You think that's more lip service, Doc?
I cannot say that until we see what they actually do from today moving forward. He made the statement, and they made their statements yesterday. Let us all, as a country, observe very closely and see what both campaigns are doing. All right, let us look and see what they're doing moving forward. Now, we are calling actually for both campaigns to conduct fully virtual campaigns. Both parties have access to social media, and they're experts at utilizing that media to get out the message. So let's see if they can use a YouTube and a Snapchat and an Instagram and a Facebook and all of that to get their message out. Let us see if we can cut out the physical campaigning, because a part of the problem, and what the political leaders have said, is that they at times don't seem to have control of their supporters. Well, if that is the case, cut out all of the physical campaigning. Just go to a virtual campaign, and let us see if we can manage the actual day itself, election day, in a way that will facilitate voting in a safe and timely fashion.
Doc?
In a way that will allow for physical distancing. Mm-hmm. Sorry, you were
Yes,
saying
I'm sorry,
something?
because we're wrapping up. I just wanted to say, let's go worst case. It may not be the big crowds, but I suspect there might be some door-to-door and some type of engagement, because I think they want to see the voter actually say, I'm voting for you. What are you hoping will happen from the voters themselves and from the people who are campaigning? Because I keep hearing wear masks, but then when I look at some of the people who are coming in and saying, oh, I've tested positive, I know they're mask wearing people. I know they sanitize. Corona seems to be a little bit more infectious than we're actually giving it credit for. So what are we hoping will happen?
Well, the wearing of the mask and the physical distancing and the hand washing and so on has been shown to slow down the spread, which is what you want. It doesn't slow it down with absolute certainty. So yes, you would have a few cases of persons who were wearing the mask and putting them on and taking them off, who have caught the virus. But let us still spread the message. And by the way, you can get the virus if you don't put the mask on and take it off properly. That's also part of it. Because in all of this, when you put on the mask, you don't want to touch the wrong surface of the mask when you're putting it on or off properly. But let us not be, it's not all doom and gloom. We are disheartened, we are very concerned, but we want persons to stay calm and not panic. Our destiny is in our hands at this point. And the Prime Minister alluded to it yesterday in his statement. There are measures that we can take to slow the spread of this virus. It's just that everybody needs to get on board, not be hard ears, don't be ignorant about it, and don't be in denial. Yeah. COVID-19 is here, and we need to do all we can do to slow down the spread.
All right, Doc. Thank you so much. Dr. Andrew Manning, President of the Medical Association of Jamaica, who's telling us spread the message, spread the word, not the
But not
virus.
corona.
Oh, thank you,
Hashtag
Doc.
campaign
Appreciate it.
Brooklyn.
Yes, okay.
Thank you.
Thank you very much. All right, guys, after the break, we're going to get an overview of the 2020 national debates. We'll be right back.